Hi, it's Jerry Holman with my presentation on the research proposal argument entitled Parent-Infant Play Interactions, Parent Perceptions and Impact. Thanks for joining me. The focus of my study is in mental health with an underserved population of infants and children ages 0 to 3. The overarching goal is to inform parents in the community on the importance of social and emotional development and also to collaborate with them in order to develop positive environments that promote mental health and well-being in the home and in the community. The problem being addressed in this study is that there's a lack of awareness, services, and support to address mental health issues within this population. Mental health disorders have increased at a alarming rate since 2010. Half of all lifetime cases of mental illness will begin at the early age of 14. Mental health policies and funding have focused on older children and adults in the past. My belief is that if we address issues that impact mental health in the early years, that we may be able to decrease the incidence of mental health issues in the later years. The purpose of this project is that collaborators will be able to understand and promote the development of social and emotional skills in this population through parent-child interactions during play within their homes. The objectives of this program are several. It's based on a participatory action research approach, which is a qualitative method and a qualitative design at this time. However, I can see the possibility of moving more towards a mixed method design and adding a quantitative component in the future. However, for the purposes of this discussion, I will describe the program as it's already designed. There's several questions that will be posed during this process. The sub-questions that I'll be looking at is, what is the relationship of social emotional development and mental health? How does parent interaction have an impact on social and emotional skill development? How do parents describe play? How do they describe their interactions? And what do they perceive to be their impact on social and emotional skills and mental health? We'll look at education on the issues in those three domains. We'll work on a collaborative effort to generate knowledge through sharing information and being able to describe our experiences. We'll then be able to come up with action through intervention. The plan is to have a semi-structured play opportunity where the parent is able to choose activities that will address social emotional skills, in addition to being able to create the environment to promote the parent-child interactions through play. Data will then be evaluated, and we will look for themes that may develop. We'll code them. We'll provide an analysis of them in written form. We'll then look at that information in terms of the program and reassess our program to make sure that it's meeting the community needs and address any changes that may be warranted based upon our findings. The theoretical framework and scientific underpinnings have been divided into 4 categories. I'm looking at our professional organization that has given us a practice framework and domain of social and occupational justice. I use the process of occupational-based practice in order to address that. I will also look at the future of healthcare and the trends in healthcare, looking at the Affordable Care Act, which identifies a triple aim, which states that the goal or the trend in healthcare is to increase patient outcomes, to improve consumer satisfaction, and also to establish evidence-based information that's going to improve treatment. Legislation that's pending addresses strengthening mental health services in the community and has within it the expansion of services to include 0 to 3 population. Scientific underpinnings of occupational science will be utilized in stringers action research, and also, of course, Dr. Pierce's 4 types of knowledge. Empirical data will be obtained through the New Jersey Council of Young Children. This is a council, state organization that develops and oversees programs for young children 0 to 3 years of age, looking at several developmental domains and defining the components of them. This is an equivalent of many states' programs, and the programs definition and domains are very similar among several states that I've been able to look at. The domain of social emotional development is domain number 1 under the New Jersey Council, and the components of program include issues of trust and emotional security, self-awareness, self-regulation, and development of relationships with peers and adults. Scientific underpinnings in neuroscience will also be utilized. The significance of the study is far-reaching. In terms of practice, it will improve current practices within our profession and also in other disciplines, contribute to research, increase awareness, and provide evidence. Healthcare outcomes will support the indicators, leading health indicators as identified of healthy people, which is 2020, and it also is reflected in the legislation that is pending, strengthening mental health in our communities. The program will be able to demonstrate immediate and long-term change within, for individuals and within the community. In terms of healthcare delivery, it's going to improve access to services. It also serves underserved populations. Healthcare policy will address the issues of social injustice within the community, create evidence that support legislation for funding and expansion of services, and also reduce costs over the long term. The literature review I've divided again into a couple of different areas that I've been able to find supportive literature in. In terms of trends in healthcare regarding mental health, we found that mental health disorders are among the highest of all disorders and the most common cause of disability. We've already spoken about the fact that they've increased in alarming rates in the last 5 years. We also have had the Center for Disease Control and Prevention completing the first comprehensive surveillance report in mental health for children. And according to that report, 13 to 20% of children in the United States that are between the ages of 13 and 17 years have some form of a mental illness, most commonly attention deficit and hyperactivity disorder. Literature that supports social emotional skills just states that these skills are essential and established in the foundation for relationships. They are embedded in the family dynamics and the social environment, and there's a correlation between biological and environmental factors that contribute to their development. Literature supporting the fact that this population is underserved talks about policies and funding that occur mostly in older children and adults, and the trend to have screening for social emotional skills early on in the primary care setting. The project method, the project design is qualitative design. The setting is in the home environment, which is the preferred setting in a qualitative approach. The data methods develop protocols. I'll also employ multiple sources of information, including observation, face-to-face interviews, surveys, review of documents, reflective journals, audiovisual taping, and also transcription. The participants are going to be very specific. It's going to be residents of Salem County who are parent or legal guardian of an infant or child from 0 to 3 years of age, and they will volunteer. So this is the non-randomized purposeful sample. The ethical considerations will be taken into considered at all times. There will be respect for the participants' rights, needs, values, cultures, and desires, issues of confidentiality, issues or any concerns, disclosure will be available for each participant. I will use a qualitative computer data analysis program in order to have a systematic approach to generate any kind of categories or any kind of themes that develop, and also to provide information into specific codes. I will provide visual representation as well as a formal written documentation of the summary of all of the methods of data collection that were employed. I will attempt to strengthen my data by following a systematic approach that's outlined in a participatory action research approach. I will use written documentation so that there will be proper content analysis. I will obtain interview training, use of the journal to reduce bias, and triangulate the data in order to strengthen the validity, as you have seen and we've discussed in my data collection and analysis section. We'll be member checking for validation and also audit trials. So in conclusion, I hope that this presentation has provided you with a better understanding of my capstone project. I look forward to having more information and sharing that with you, and I thank you for your time. Take care.